What should you do about your depression? Well, my name is Dr. Story. I've been a chiropractor for over 23 years, and I'm going to give you realistic advice based on my experience. A lot of times patients come in and they have depression, and the first step, the first thing that you should be doing is getting a counselor and getting on medication. Now, I know that's a strange recommendation from a chiropractor, but that is the gold standard with depression. Now, let me tell you my experience. Most people that come in have already done that. Now what do? I'm going to give you my advice, because very often your doctor and your counselor just simply don't have time to tell you the alternative things to do. Number one, you have to exercise. Exercise does so many things. Just Google it. It releases endorphins. It makes you feel good. Even patients that don't like to exercise, you have to get out of the house and get into the sunlight and do some form of exercise. Now, what's the best type of exercise you can do for depression? Most of the research shows that aerobic, steady exercise is beneficial for depression. In fact, when people start exercising regularly, they're very often able to cut down on their medications because they simply don't need it. So, exercise is important. Not high intensity exercise, not strenuous exercise like weightlifting or CrossFit, but some type of walking, running, hiking, cycling, swimming, something aerobic type of exercise that you can continue for an extended period of time. Number two, your diet. What you should do is Google Jordan Peterson and his daughter about their diet. Now, this is an interesting story because Jordan Peterson is probably considered the number one psychological person, at least on the internet or the world today. And what's interesting is his daughter changed her diet and literally was able to reduce her medications. Jordan Peterson, the scientist, couldn't even believe what was happening, tried the diet himself, and noticed tremendous benefits as well. If a psychologist or psychiatrist can benefit from it, the most skeptical person for this, then it could probably help everyone. So changing your diet, and again, your medical doctor and your counselor are probably not going to make these recommendations very strongly because they just simply don't have the time. The third, and this is going to sound biased, but it's true, see a chiropractor. A chiropractor can change how your body functions at a neurological level. A chiropractor can change your posture. I'm going to give you an example. I'm going to stick my chest out, stand up straight, and say to myself, I feel depressed. You see, there's a mismatch. You can't do that. Likewise, if you round your shoulders forward, look down, have a sad face, and say, I feel happy, that's a mismatch too. It doesn't work. Now, a lot of people, when you recommend this, they'll say, you don't know anything about depression. You just can't fake your way out of it. Well, of course you can't. That's why you're on medication and that's why you're seeing a counselor. But what's the big deal about faking it? And you're not faking it, you're changing your physiology. So that's my recommendations regarding depression. Alternative examples in addition to the medications and the counseling. Very often when you do these things, it can actually significantly impact your health and your mental well-being such that you may be able to reduce the medication depending on your situation. If you thought this was interesting, give me a thumbs up, subscribe to my channel. If you have any questions, ask in the comment section below. I'd be happy to answer them for you.